Health Innovation Talk, a series where we speak to industry players and thought leaders about their revolutionary business ideas and innovations that are transforming the healthcare sector. Today we have with us Ms. Galveen Kaur, co-founder Connect and Heal. Welcome. Connect and Heal is an
Thanks.
integrated health tech company that has been working for the past 5 years to understand the existing healthcare delivery challenges globally and also towards bringing the concept of a healthcare management organization to India. With a presence in over 60 cities and registered offices in over 5 cities, it provides a 360-degree healthcare through its core multidisciplinary in-house team. Welcome, Ms. Kaur. Thank you so much for joining us.
Thanks very much for having me here.
So, to begin with, Alvin, if you could probably brief us about your organization, the offerings that you have.
Okay, sure. So, Connect and Heal is an integrated care manager. And what we try and do is actually connect all the dots in healthcare because, as you're aware, healthcare is extremely complicated as an ecosystem in terms of all of the parts of the varying care needs that you require for different kind of requirements that you have, right? And what we do is help patients navigate through all the healthcare needs that they have, right from connecting with us to whether it's an emergency support. So we are one of the largest aggregator of ambulances in the country with 4,000 ambulances that we have. We are a telemedicine partner, so we run around. So we are a telemedicine partner to over 400 clients, where we run 24 by 7 telemedicine across all specialities. We also run health screenings. We run hospital assistance programs. We run wellness programs. We run clinics across 200 corporates right now. So we are an end-to-end healthcare provider.
Wonderful, wonderful, Alvin. So,
And
in
today we
terms,
actually
yeah.
handle around 1.6 million lives, 1.6 million employees that are under our current coverage.
Great, great, wonderful initiative. In terms of, the key healthcare delivery challenges in India. So, how would what are those challenges? How would you identify them?
I think the biggest challenge that I see in terms of healthcare challenges in India is actually fragmentation, right? There is no horizontal provider of all healthcare requirements, and there are too many drop-off points that you find, right? There is somebody who only looks at diagnostics. There's somebody who's a telemedicine provider. Then there is, when you need an ambulance, you go to somebody completely different. Hospitalization is handled very, very, very differently. So the biggest problem I find in terms of healthcare is you have all sorts of requirements and everything is extremely fragmented, right? You'll have to go and visit multiple different places in order to try and get the care that you need. And what eventually then happens is your care outcomes become extremely suboptimal, right? Because nobody's actually optimizing for the care that you require. And I think the other thing that specifically is a problem is it's very difficult to establish trust in healthcare, right? Unfortunately, incentives are very wrongly aligned. Healthcare providers get paid to keep people ill and not well, technically, if you think about it.
Right, right, right.
So how do you find a care manager that is actually truly vested in terms of ensuring to keep you well? Is I think, according to me, one of the biggest challenges. And it's not India specifically; it's actually across the world, right?
Right, right. So you talked about, fragmentation. So fragmentation, is it there just in the primary healthcare system or does it, run across the healthcare system?
I think it's completely across, right? It's a problem across the entire value chain of healthcare, not necessarily only primary care, right? But the problem is because there is so much over dependence in terms of tertiary care, people have forgotten primary care at one point in time. In case somebody had a flu or a fever, people used to still run to a hospital. And that's completely because the primary care system in itself is completely fragmented and broken, right? You've got diagnostic chains that are completely operating very independently. In case you need a family doctor, you don't really know who to go to because we're a migrant. A big chunk of India now is a migrant population as well. They have shooed away the concept of what a family doctor is, right? So, and I think what also happens is the primary care system is not talking to the entire tertiary system, right? Because there is a pre-care that is required. You may require a hospital intervention, and what happens after that? You need to come back to primary care. So that entire handoff across all healthcare delivery systems is right now not happening. I mean, there are attempts to sort of fix this, but it's not happening in the desired way that it should ideally happen.
Right.
And what we are trying to do at Connect Energy is, of course, bring all these pieces together.
Right. So, we've identified the problem. So, how do what are the proposed solutions to meet these challenges? So if you could probably delve into a bit of detail.
I think what we need to realize is, so in terms of the problem, healthcare is both in terms of bringing integrated. We've brought together an integrated care platform, right, which is sort of amalgamating what your offline and your online needs are, right? So while you keeping healthcare online enables very quick delivery, which is what is required, but also ensuring that it speaks to our entire offline systems. How do we immediately able to mobilize the touch points that we need? In terms of, so the biggest thing that we've actually sort of, the solution that we've sort of curated is actually creating an integrated care platform, hyper localizing a platform that serves the everyone's need, right? Because at very different varying demographics, you require very different things. An elderly person probably requires a lot more care. Of someone who's in their 27, 28, just needs to be kept aware in terms of how do you keep somebody well. Karima, I think in my perspective, the proposed solution is one that is first putting the patient in the middle of everything, right? It's a patient-first solution that looks after all of the needs that the patient has right from the time, they sort of connect to you, irrespective of what the need is. It could be a simple blood test, or it could just be an acute sort of illness, but a solution that is solving for all of those care needs. That is also integrating the platform, integrating between all of someone's offline and online needs. Online, so that you can actually do it at scale and are able to sort of give it to someone as quickly as possible, and also ensuring that the platform is integrated with actual offline requirements, because just being a health tech platform is not going to be sufficient in healthcare, because how do you ensure service delivery happens? Yes, to some extent, healthcare is still very much a touch and feel kind of a need, right? So,
Right.
in case such a need is such a requirement is there, how are you able to actually integrate and provide for that particular need? The other thing is, in terms of a solution, is how do you hyper personalize a solution? Because everyone at very
Right.
different demographics, at very different disease prevalence, requires completely varying kind of healthcare requirements, right? Making sure that you are able to sort of cater for all of that, and ultimately it is to be able to provide better outcomes, right? So in my view, it is trying to be the first port of call to be able to provide an integrated care solution for any of your healthcare needs, and working towards a better outcome.
Right. So, we've seen that, innovations all across the healthcare ecosystem have been creating a transformation that has, of course, taken healthcare delivery to another level. So, two bits, what innovation or innovations do you further see accelerating the pace of transformations in the healthcare sector? And secondly, how can a collaborative environment be built for a faster adoption of innovations in the healthcare system?
Right. So I think, I mean, like for me, in terms of innovations, the glaring one would actually be in terms of medtech integrations. I think we've come to a point where now wearables have evolved to a level that they can alert you in terms of any kind of requirement, and they are a great supplement from a non-invasive perspective. And what it will do is it will sort of shift, it will sort of also play a very big role in terms of helping you prevent and interconnecting it to create a longitudinal health record, right? So I think medtech integrations, definitely a greater use of digital therapeutics, And the other thing is also interoperability of data, right? If data can flow in a lot more freer fashion from, and at the same time ensuring that patient security is always, maintained, that will help sort of remove the information asymmetry that is very prevalent in healthcare today. And just in terms of collaborating environment, I think there are a lot of great healthcare companies that are solving for very different needs right now, and some are specializing in something very specific. Some are specializing in diseases, some are specializing in solving very varied points in healthcare. And I think just just the ability of having greater integration with a lot of these players will ensure that we create much better adoption to ultimately solve for better care for patients.
Right, right. And in terms of, your future roadmap, where do you see
I think just in terms of a roadmap, I see us sort of, getting into much deeper, integrations that, integrating all the varied pieces. We've started with a segment. Also, also going down the route of, enhancing our clinical capabilities across, because ultimately, how do you sort of, if you want to provide care at scale, strengthening our clinical capability roadmap is also a very important thing from our perspective, because that will sort of create better care outcomes. I think we
right?
also sort of, hi, are you able to hear me?
Yeah, 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 absolutely.
Okay, sorry. And I think the other thing is also greater collaboration with other players in the market, right? Because can't solve for everything, but how do we plug in the best? Because ultimately, if we want to put the patient at the center of everything, making sure we plug in what is right for that particular patient is what we see as our future roadmap.
Right, right. And just one last question, in terms of the technology, what is the futuristic technology that excites you the most and, probably makes you look ahead in the healthcare domain?
I think definitely, for me, definitely medtech. The ability that you can do so much more in terms of also looking at, I mean, it helps you in prevention, it helps you in acute management. Just, like it will completely change the face of how we look at healthcare. And the other one would be robotics, I think.
Perfect, perfect, great. Thank you so much, and our best wishes to you to connect and heal, for a very bright and prosperous future ahead. So, thank you so much. It was wonderful
Thank
interacting
you.
with you. Thank you.
Likewise, Garima. Thank you. Take care.